to the old Pulse of Healthcare. It's Dr. John McCormick. I'm here today with Nick, and Nick's been with me for a little over a year now.
I would say a year and like 4 months.
Year, 4 months. Yeah,
you know?
Yeah, and kind of the tone of this podcast, we're going to keep it short, maybe 10, 15 minutes, not too long.
All right.
But what I want to talk about is, we spend a lot of time talking about the need for education for members and employers and things like that, and navigating this crazy system. But you know what? We have to go through that internally too, right? I mean, it's not like we can just reach out into the street and grab somebody and bring them in, even if they have previous healthcare experience. It's different because we do things differently. All right, so it takes, and I talk about this a lot, it takes anywhere from 90 to 180 days to what I would call make one of my healthcare Sherpas, at least competent enough to lead you, from out of the woods, to the actual sources that you need. All right, which may not be what you want, right? Sometimes we have this conflict of, well, I need fill in the blank surgery, fill in the blank medication, fill in the blank, right?
Yeah.
And one of the things we've always said is we don't say no, we say not that way, right? And so in order to do that, we have to have people to guide, because obviously I can't do it for everybody. That would be impossible. All right, I have to have people and train them, say, we need to learn how to guide our members from the wilderness that they're in or the misconception that they have, into the way to engage healthcare in a smart way. So I thought it'd be kind of cool to bring Nick in with all of that and say, Nick, kind of walk us through your evolution over the last year and 4 months.
All right.
And it'd be real candid. Say, when I first got here, it was this, and then it took me so long to get to there. Whatever that is.
Okay. Yeah. So let's see. It starts off back in October of 2024. I was 21, and I knew zilch about it. The closest I got a routine visit with my doctor at Kelsey Siebold since I was a kid, and I had workers' comp stuff, medical stuff I had to deal with, but that was the extent of the healthcare system that I knew about, and health insurance.
You were still on your mom and dad's policy at that point, right?
Yeah, still on mom and dad's policy. And the most complicated thing I did was, call my insurance company, Cigna, to check allergy CPT codes. At the time, I had no idea what a CPT code was. I was just told, "Hey, read this number to the person on the insurance company online, and they'll confirm if it's covered." I was like, "Oh, okay. I'll do that." So I didn't know anything. I had no idea, but should I tell the story of how I got here?
Sure.
Open
the floor up.
He was saying that you really can't just get anybody off the street, but he got me off the street.
Literally off the street.
Yeah, literally off the street. I was in a cardboard box. No. I was unemployed for about a couple months. I had gotten a job that I had to leave due to an injury, long story short, and after I recovered, I was going around our town here, going from place to place, handing out my resume. Hey, my name is Nick. I'd like a job. Could you please hire me, please? And not getting a lot of success until one day after a workout, I went to Chipotle, and right next to Chipotle was a cookie store. I was like, what the hell? I'll work at a cookie store at this point. I don't care. I don't care, man. So I did. I went in. I was like, hey, my name is Nick, and here's my resume. Would you all be able to hire me? And they said no. Which sucked, but at this point, it's like, what are you gonna do? It's happened so many times. But little did I know, I probably actually shouldn't do that because of the mic, right?
Right.
Okay, never mind. But little did I know that Dr. John was in there watching me do that, and after I left, I mean, yeah, you went up and you just asked for the resume, right? They dipped it in some cookie dough, and it was like
I was impressed with your overall demeanor, communication, and your willingness to be out in the street.
I guess so.
Be in the street looking for a job. And I said, we can use people that are motivated and willing to work, and present themselves well. And you checked all those boxes. So I said, hey,
apparently.
and we just happened to be hiring for front office. So it all kind of lined up.
So yeah, no, all that to say, yeah, I knew nothing, and I didn't even I kind of just stumbled into the insurance world. I had no knowledge whatsoever, and as you said, I started off at the front desk, and it was Jada who showed me the ropes, our previous front desk woman, and it was a slow climb, a lot of growing pains, as you can imagine. Learning CPT codes, what is covered, what's not, why we only cover the Zempic for diabetes and not weight loss, all that type of stuff. A lot of stuff like that. I didn't even think about it.
A lot of people don't understand. A plan document for, if you're looking at an insurance carrier, they offer multiple plans.
Right.
We offer multiple plans. Not as many. We offer like 4 variations on a major medical. Each one of those plans by itself is almost 350 pages long. All right? Now, I know nothing about healthcare. Somebody's bringing me in saying, hey, welcome to the healthcare world. You know none of this language.
The language, the verbiage is the most difficult part.
Yeah,
because everybody's got a different dictionary that they're spouting off words.
We're all speaking in medical code. CPT code just one of those codes. But after 22 years in the military and speaking in acronyms, getting in the healthcare world was like learning. Oh, that acronym book is garbage. Let me grab this whole brand new acronym book. Oh, it's thicker and means less.
And the print is smaller and it's denser.
Yeah. And some things, the same thing has 3 different ways people talk about it, depending on if you're talking about it from the member services side or the claims side or the doctor side.
The front office side.
Because
the front office doesn't know what the hell they're doing,
They're like
they're on their own current.
Most of the doctors' front office are the same thing. They're just somebody off the street. They brought in and said, look, we need you to take appointment calls, and here's the list of people that you can accept, and this is how you verify benefits, and hey, good luck to you.
That's true. On your merry way.
On your merry way.
Get going.
And so their training is very
brief,
on time, kind of deal, like as needed. So there you were.
Yeah.
So now with a couple of thousands of pages of different text in front of you and a whole new book of words to learn, you started down the path. And about how long had you been here before you were ready to tell Jada, one of our other staff members now, okay, I think I can handle it mostly on my own? About how long do you think that took you?
I think, let's see, I started in October. I think around December, January is whenever I was sitting by myself at the front desk, because Jada would, sit right next. And at the time, she was training for claims, too.
Right.
I think it was December. I'm pretty sure it was later in December when I had the hang of it, for the most part. Yes, still I was asking questions. I still ask questions to this day.
I do too. I literally learned something about this multiple times a week. Wow.
Just jumping out the woodwork, just surprising you.
Didn't know that.
Yeah. But yeah, no, it didn't, the actual benefit part, because prefects, I was context, I was at the front desk, and the main call I would take would be a doctor's office calling in to get one of our members' benefits right. And it was pretty easy once I got it was easy to get the hang of those types of calls because, it's routine. You just got to figure out the best way to get the information down, and you get a system, and yeah, no, it was easy. The harder calls were definitely the member calls, because talking about education in healthcare, a lot of times the members, they don't even know what they want, so they're not only trying to ask you to fix their problem, they're trying to get you to understand their problem and get you to help them understand their problem.
And I love that. That's a unique perspective. We talk a lot about, it's easy to get jaded in this business because we deal with real crises every day. I mean, serious medical issues. People call up that we are, jumping through fiery hoops trying to make sure that they're taken care of. But at the same time, we deal with a lot of lower level medical concerns. But as I've said before, when you have a medical problem, that's your only problem. And it doesn't matter if it's to Dr. John McCormick a big problem, to you it's a big problem. Even though to me it might be, really? Yeah. Really? That's the one you're calling about?
We're having a panic attack over this? No.
But when you're calling in, so it's very important for our Nick of the world here and the folks like him to first understand that it doesn't matter what the crisis is, it's a crisis.
Yeah.
And then exactly what you just said. Sometimes I have a crisis and I don't know. First, I don't know how to explain it. And second of all, I need your help to explain it back to me. So I'm just telling you what the problem is.
And provide a solution on top of it.
Yeah, and give me a solution.
Yeah.
And can you help me? And can it be 5 minutes before I actually called you?
Right.
Because I'm in panic. I'm having a panic attack.
I'm in the doctor's office right now. They're waiting for me, and in turn waiting for you.
Right.
Yeah.
And I went to the wrong doctor. I'm sorry, I'm at the orthopedic surgeon, but really what I need is some blood work.
I need to do a couple stretches as well.
So I'm at the wrong office with the wrong modality, but hey, please solve this for me. So this is where we talk about people wandering around in the wilderness all the time, and the fact that we're very concierge when we want people to call us. Obviously in non-emergent positions, we want them to call us first and allow us to guide them down the path that's, one, the easiest for them to access, two, gives high-level care, and three, is the least expensive, right? So those are kind of the three factors that we want to look at. And if I was throwing that back to you and saying, now you've been here, of course, over a year, you've done a lot better. You just went to your first Broad World Conference with me.
I did.
Tell me, what was that experience like? Because, you figure you've kind of been in the cocoon of this plan for a year. And now you're out of the cocoon for the first time.
I wouldn't say
you were like
out of the cocoon yet. I think I'm breaking through. The wing is starting to come out. The antenna's poking out.
Yeah.
But you have to continue.
Yeah, but you're now starting to see other people that are in this space. So it's not like, oh, that Dr. John guy, he was just, I thought we were the only people in the whole world that did this.
Right.
There really are other TPAs and other plans like us out there.
There was probably two or three other adjacent plans to us at Symposium, right?
Yeah.
Or maybe four? I can't remember.
About three other plans and then several vendors that did slices of what we did.
Right. What was that like as still emerging from the cocoon? Man, it was really interesting to see how many people are involved in this business and the very different things that they do. Because truthfully, I didn't know really what a PBM was until I went to the symposium, and obviously we watched the documentary.
Right.
We watched the documentary, but then we met with the Congo guys, and they explained their process, and then learning about where medication is sourced from. We met the guys from
Israel.
The Israel guys, yeah, and then There was the person from New Zealand too, right?
Mhm.
And just learning about how sketchy the whole pharmacy side of things is, and how you really got to find a good, reliable person to be your middleman, or else the member's getting screwed over. It's crazy to me that you can spend more money with insurance than being a cash patient getting medication.
It's mind-boggling.
It's mind-boggling because it's like insurance.
I mean, if I pay cash, it's $5, but because you ran it through my plan, it's $50.
Or worse, like $1,000. It's crazy.
I'll pay cash, thanks.
It's ridiculous.
But that's part of your role, right? To help and say sometimes it's like, and we've got a great PBM because it is completely transparent and it is passed through. And if the cost of the drug is actually lower than the copay, you pay nothing, or you pay the cost. So if your copay was going to be $5, but the drug's $2.50, you pay $2.50. They don't charge you. Oh well, you went through your insurance, so you have to pay $5.
Yeah.
No, you pay $2.50 because that's the cost.
Right.
But that's the wide range of PBMs, because you could go to another PBM and they go, your cost is $5. Well, then what happened to the other $2.50?
Right. Who's paying that?
We didn't get it.
Yeah.
You don't get it.
Mm-hmm.
It didn't come back to us. It doesn't go back to the member. It goes to the PBM's pocket. Profit. But you're already paying for the privilege to use them as your intermediary in your plan anyway. So they're getting paid twice. That's not fair. I hate it. Anyway, so that's really cool. So if you were going to sum up for me, what would you say your overall experience has been so far? And if you were going to advise somebody like, hey, if you're looking for this kind of job, what would you tell them?
Experience with Ovation Health?
With Ovation Health.
Ovation Health. That's a thinker right there. I'm going to have to ruminate for a moment. Let me see. My overall experience, it's been a good experience. It's been a very educational experience. I think it's really sharpened my people skills a lot. That's probably not the answer you were expecting, but being on the phone a lot has really shown me how people operate with people who they don't know, because they kind of, not only that, but also how I operate, because I notice the patterns and how they speak to me and how I speak to other people. It's kind of hard to remember that the other person on the other side of the phone is actually another person on the other side of the phone, and it's something you have to keep in mind, because, everybody's been working, you say you call someone at 3, they've been working for at least
sometimes 7
quick math.
hours.
Quick math is not my strong suit. So a lot of time. They've been at the office for a lot of time.
That's why he's not a pharmacist. Just saying. We don't require math. No math skills.
Wow.
So somebody came up to you and said, hey, Nick, saw you on that podcast. Looked like you were having a great time. How do I get a job like that? What kind of personality type do you think would be a good fit for this kind of job?
A good personality type. I think you need to have a lot of patience, for sure. You need to have a lot of patience, and you need to be able to understand other people. You got to have empathy, for sure, because not only empathy for whenever members call in and have, really serious issues, but also empathy when it comes to, hey, the other person on the line might not have it together all the way, and you got to understand that, and you got to be able to work with that, right? And you can't just be like, what's the word I'm looking for?
You got to meet them where they're at.
You got to meet them where they're at. Yeah, exactly.
Yeah, you got to meet them where they're at, and that's a whole skill that you've got to be able to rapidly identify where they're at, and then meet them there, and then hopefully bring them along with you.
Yeah,
right?
You got to adapt quickly, right? Yeah, because that's another thing that you taught me is being able to teach yourself how to adapt. Because a lot of times I've had a call where a member calls in and is like, I have this huge, enormous problem, and you need to fix it right now, and they're very combative, and you have to you can't like shut down. You can't shut down like, oh, I don't know.
What do I do?
What do I do? There's definitely been more than one of those. So you have to have a strong shield, I guess. I don't know.
It is. You kind of got to emotionally brace yourself.
Yeah, you got to be braced.
It can certainly be traumatic listening to people, express their medical concerns to you because you're empathetic, and we all are. It's tough. I mean, there's some people out there in real crisis, and to do that, in the military we used to say semper gumby, rigid flexibility. We are constrained by the plan. So there's only certain things we can do, and we can't go outside of that and approve things that aren't part of the plan document. So there are some structures that we have to operate in, but at the same time, we have to be flexible enough to meet that member's needs, to the best of our ability. And I think that's a great summary.
Yeah. So to like put that on a list, because I kind of like spitballed a couple ideas and didn't put it cohesively. So you gotta be able to brace yourself for anything that comes your way, because you're the front. Because for a majority of my time here, I've been the front man on the phone, right? So you got to be able to brace yourself. You got to be empathetic, and you have to be patient.
Absolutely.
That's it.
Hey, Nick. Well, thanks for joining us today on the Pulse of Healthcare.
It kind of surprised me with this one. Like, oh,
well,
I'm gonna be on the podcast. All right.
He said in the hall, he says, "I'll do a podcast." I said, "You're on."
All right,
come on.
And here we are.
Bring it.
Thank you for bringing me on. Yeah,
you bet.
Yeah, it was fun.
It was a great time.
All right.
Thanks. Bye.
Take it easy. All right.